We see, I think there's a lot of talk about climate change over the last, through this meeting over the last few days. We see that during the last 100 years, human activities have been changing the climate and ecological environment adversely. These changes will result in even more disasters brought about by heat waves, heavy precipitation, intense tropical cyclones, and other ecosystem disruptions. Next slide, please. We are facing more disasters that threaten our life and health, particularly in this region. I think you need to go a slide before. Between 1990 and 1999, about 2 billion people were affected by disasters, with almost 600,000 fatalities globally. More than two-thirds of these deaths occurred in Asia. And it was reported that over the past 10 years, the Western Pacific region, with 37 countries and areas, encountered 127 major disasters, meaning 23% of all disasters worldwide. The health sector, as a lifeline of rescue in disasters, also suffered from and was damaged as a result of disasters. And this puts people more at risk. Just to mention a few, next slide please. On May 12, 2008, who would ever forget the earthquake in Sichuan, China? It has destroyed over 11,000 health facilities in 3 provinces, including hospitals, disease surveillance and prevention institutions, and clinics. It caused over 69,000 deaths, over 374,000 injuries, and 18,000 persons missing as of August this year. Next slide. Those are pictures that were taken of the earthquake in China. Next slide, please. Next slide, please. And those are examples of how health facilities and hospitals were damaged. In 2008, Typhoon Frank or Fengshen destroyed or damaged numerous hospitals and health facilities in southern and central Philippines, further aggravating the suffering of disaster victims and their families due to lack of medical services. Next slide, please. And those are the pictures, and I think you've seen the, some of the inter-island vessel that has overturned because of the typhoon and causing other chemical spills. And next slide, please. The tsunami of December 2004 damaged or totally destroyed more than 360 hospitals and health facilities in Indonesia, Sri Lanka, Maldives, and India. It killed more than 220,000 people and displaced over 1.6 million people in 12 countries across Southeast Asia, South Asia, and East Africa. Next slide. Globally, hundreds of hospitals and health facilities are destroyed by natural or disasters or damaged every year by such hazards as earthquakes, hurricanes, and floods. Millions of people are left without emergency care during and after disasters when hospitals and health facilities fail to function. And millions more are left without public health and clinical services when operations are disrupted due to damage to health facilities. Next slide, please. Next slide, please. So clearly, all disasters are a health issue, and damage to health systems affects every part of society and nations as a whole. Next slide, please. So why we focus on hospitals or health service facilities for that matter? There are 3 arguments to this: the economic argument, the social argument, and the health argument. Economic argument, we all know that hospitals are huge investments. Building of hospitals, equipping them are huge investments. And if these are damaged, these are huge losses to the government. But there are also indirect costs in terms of productivity costs, efficiency losses, when hospitals fail to function, then there will be more costs rather than just attributed to the infrastructure that were damaged. The social argument, health services or hospital facilities for that matter address or they respond to basic human rights of a person, providing health, which is a basic human right. And the absence or the weakness reflects on government's failure to provide for basic needs. I think you've heard how some of responses of government to certain emergencies, when they failed or when the public perceived that they were rather slow or were inadequate, there was loss of confidence in the government, and government's popularity may go down. I think Katrina, the Hurricane Katrina, you've heard a lot about arguments about how rescue and rehabilitation could have been done. The health argument, I think, is pretty straightforward. Health facilities provide emergency care, health surveillance to prevent outbreaks, and follow-up activities even long after the emergencies or the disasters. Next slide, please. So in order to reduce risk, protect health facilities, and to save lives in disasters, the UN, the United Nations International Strategy for Disaster Reduction Secretariat, UNISDR, and the World Health Organization initiated a global campaign named Hospitals Safe from Disaster. And this is with the support of the Global Facility for Disaster Reduction and Recovery of the World Bank, other UN agencies, governments, and non-government organizations. The campaign was launched in January 2008. This will last only for 2 years, as you can see, 2008, 2009. But the momentum that is gained during the period will help sustain and maintain and mainstream disaster risk reduction into health planning initiatives. This was aimed to direct attention towards the building and maintaining of hospitals that are safe and optimally functioning, especially during disasters. Next slide, please. During this campaign, we also wish to urge governments to have developed their strategic action plans to ensure that their hospitals and health facilities will be safe from disasters, and that they have integrated disaster risk reduction into health policies and programs for achieving the strategic goals of the Hyogo Framework for Action by 2015, and this was spoken to earlier by Feng Min Khan. Next slide. The objectives of the campaign are threefold. First is to protect the lives of patients and health workers by ensuring the structural resilience of health facilities. Secondly, to ensure that health facilities and health services are able to function in the aftermath of emergencies and disasters when they are most needed. And finally, to improve the capacity for risk reduction, including the emergency management capacity of health workers and institutions. Next slide, please. When talking about hospitals safe from disasters, we mean something more than just protecting physical structures. Hospitals are regarded safe from disasters when health services are accessible and functioning at maximum capacity immediately after a disaster or an emergency. Next slide, please. A safe hospital can continue to function and provide services as a critical facility when it is most needed. It will not collapse in disaster, killing patients and staff. And a safe hospital is organized with contingency plans in place and health workforce trained to keep the network operational. Next slide.